longest time, they just called it juvenile diabetes for type 1. The reason being is young children got it. They got it while they were a juvenile. And over time, and as we're trying to learn more about this disease and trying to understand it, even though it's so difficult, they had to change it to type 1 because not just juveniles are getting it, not just young children. Like my husband, he was 26. And I've heard of a lot of other older people who've gotten type 1. So there's that. And then type 2 diabetes used to be called adult. So you had juvenile diabetes and you had adult diabetes. They can't call it that anymore because they've noticed that younger children can get type 2. They've noticed a lot of maybe kids that aren't quite as active and maybe don't have the healthiest lifestyle. Their body's having trouble utilizing the insulin, and that's where the type 2 diabetes comes in. So the main difference between the two, I wish they had different names because they're so drastically different, but type 1 diabetes is an autoimmune disease where the cells within the pancreas attack itself. The pancreas can no longer now produce insulin. We need insulin to stay alive. The only way to get insulin is through an injection. So that's what I have. That's what we have over here, our little trio. All of our pancreases decided to stop doing their job. So sad. But type 2 is just where they need to exercise and eat good. So the doctor might say, hey, you're borderline type 2 diabetic. You need to really watch what you're eating and exercise actively during the week, not just occasionally. It needs to happen more often. So with all of this, they can manage it. And then if they're still not doing that, then it might get to a point where they do need to take a pill. And what the pill does is it says, okay, here's this insulin, let's utilize it properly. And then they can manage it by taking a pill and eating and exercising good. Whereas type 1, we're just, out on the lake in the boat without a paddle. We're stuck. We have to do all those things anyway, but it's the insulin that we're lacking. So they are very different. But then once someone gets type 2 and they're taking that pill, they need to eat good and exercise good. And if they continue to have a hard time with that, they can actually get to where their body becomes insulin dependent, where they need it, which is how I am because I don't have it. So I just look at that and I go, oh my gosh, be so thankful that your body is producing it and your pancreas is trying to do its job. It's just having to work extra hard. So cut it some slack and, try to make it better so that you can live better and live a healthy life with a functioning pancreas. So those are the main differences.